Shik edo shine kodoti the modo na kijone nani ko kodoshi ya ihe nan hidi nidole ade khata siyo gizi kodo ya COVID-19 town hall update ni the question sanas es adapedi nini kodo bana huilne don jikishi kodo bana huilne don hinat lini do is il endan lini kodo khan lini hich honel قلت توريزن لني بقى أني قداشين تديزن دولار قداها جان دولار شمانا هستان يد الخيل زليستان تويستان شال خيل خيول قال ناديتوي هالش إلتي هالش إيوان تخدتين أني سأنا غيبك أهجان دي إبني بي كون تتناديزن آكوي جاي قدام تتديزن يا أتأها كون هيدنا بالخهات بقاء نهيل ناست آدولة دي نو إيكون آكوي جنسو ديلزن آدو كون هيدنا نخاست وين هزاني دان ليني كون باقوليا دوبك إدن آدوك إبداك إنداز كون خالشنة نخيش تشين دان له بالغداشي جي نهيمان هجاء نهيماياجي كدا دان له آد إندا بنيلني قادينا يا أتأكو نادا ألتهتو له ناسكو نتنجي إخين نادا إلتيتو أي نيتزن دكوي نا كنا خدوي وهادا كون دكوسن تا بدي نو كون هيليا إلني آدو دي جينجي كون أتي أويو نجيكيش نيكيت أدولتو أي نيتزن شمانا حسان ليني يا أتأكو كون نيك خدو له ناسكو نتنجي إخيلك نادا ديلني دولة إخين نادا إلتي دولة آدو كون هي كيا ناز آنغو نيهو ونازلو ني كونتا دلتلي آدو نيهو نشكيش ناز خانغو ني تقوت ناز خانغو يا أتأهو نيهل ناهو تقولة يا أتأهو نيهل ناهست آدولة نيزو أدي نكون شما ناهستان ليني كون دي يندن أدا نطليني نيهي تورزن دا ديت نيهيين دا ديت إن خدا ديينو إنسان كون شما ناهستان آدو يا أتأه كون هنات ليني كون باقول يادو له آدو الله كون خديل نشي نهيت الله دان له نهيت الله صودان له اتسيسن دي جاي كون دين سسه آدو له هو تا خيجي دان لني سيكش آدا بدتنني آدو بدا ألتخا إيدون خالشن هي يجن هي أويج إنها يا أتأه كون ألتخا لني إنا ديل يادو له آدو كون إزاء الأبل ناس آغون هي إزاء إنا إزاء ني قادن لني إشت أدهسني دا آت إنا بنيلني دولة يا أت إيكو كون نيك دولة يا أت إيهو ناني دارولة آدو آدي غدا أسكيزن لني خادن شيطان التآدن كون دي يندن أبل دهون لا دولة كون صون أدشنا كون شماناستان دي يندن أدان نخليني آدو كون أو يوبوشي بين هيتزوزن لاندان but todizin lini kon ahon jende be nana si ole ahon de dal neshit hon benashni ole edo jono na dal nestole benat ani da holini yis ole alonat ani lini to bandal neshi yis ole ani te konst nani kredole aro di kon de kosnas ets atapedi nini jikishi ni hits alto dole kon za kon dasli ole aro alla ani zinon ka anna holya dole hot to na desin dole adi de ben hich ojanasli ya nanet eshik edo shidne kodoshe kon sago to de zin lini be a nane ya dole aro din hinat ani lini do nihe eze il ini lini kodon hich ye hanatze do ya ko kodo nihilch hat aton hizan lini lo bata hafliash edo shidne njono sad lini bi ita kodoshe as a lini kon honorable President Jonathan Nez, Mr. Nez, you have the floor.
Hela shada kudon khatsudin zinigi do hanet hije queen lag ado kido ade ne sada tilzano ade nakha ade beslinan inigi do Fowlers da hikajido jido ni hin shida stil jo koni himani hija nitsa din naza do benanishi yilag gido ba kenitsen Sally Fowler shin hitsa naza do kondemenanishi yilag gido kudo ba kenitsen do ba chen yanjon go yahos so Henry Fowler jo logic a Department of Education jin khata sadado Lena Fowler inlay Coconino Hahotsoja na Dani Lindo La Kaje Ishi Kudobatso Dilsen Do Alchindo Tsoke Nalake Dan Lingi Ishido a head of the Nido Les Kudon Himasali and Hikael Wato Shido Shimahut a Benashnik do Les Hot to the Zinba Ko Edan Lingi ba inch kid or less. Dog home to the Zinia had see Dr. Fowler to a Henry Fowler you see nice Rodon Ophelia a Perfilia a Kodo you can't not what to the Zin Nuka Yahanats do Khal now banana she though it's still a data on the vision of human resources agent what a here that the need or less agent Aidan Lengido Sadaj Jegi. Arabin Yaho Agi DJ a Yakon the cousin Tragina hast AIDS ata a Nachin da ich Tragido Zel in Dan Lengi Bananish in Gijo the cousin Tragi then Trat Nacha Nihilya Ishni the Nabiki Apokao Ako Dendel Ki the Nihik Enihin but that the Binda del Nagi do Yandel Kikare Ashon Yasil Kid. Ja, dan ich niet alles Eroshin are da is noch tsagi da dan ich nafgi Kodoshi han net nicht kondal ni joba inch kesh keno sin Kodo bata hosne Kodoshi o atra da hui nende a kuichi Kodo di han net nicht kondal ingi ni keni hinne bicha ashane dalle da inosne sa do na antikin nicht kodal nagi Tashige go kun khalchin da ich tragi sad ya lagana ketchu da yosh ind hishi kodo Dr. Fowler yich ashana nail the neck etchigo ado tido hat ishi yish ya na nasni no wa na han monkeypox e ade di jinje asa kon mi ken hinne bedol na the Gallup Indian Medical Center hahot zoge kon asago ya kon hiken hinabedol na monkeypox ada inosne din hi masto hi la fedas choshne serigi chodas monkeypox ne sedo das kenosni ebenina ada inosne da dinne doe din hi Washington danatel khafa Beninage ani tron hilbeusen hat ishi ya hanet hije kodal yagi bikije na annesh do ata hui lianigi en hitsare hije kondal so ebinina hijo ba inch kech kenoslini na antinigi kon benda no tinch kedo shna ashwade ado kodo zel indan linigi alad tasadagi Dr. Jill Jim It's East Bahia Jido Department of Health as AJ Laj Tasadado is Laj Ecuador Bishahande Kle Washington it's East Bahia Abol Tom AJ Ya Laj Tilidane Linigi Roseland So Captain Brian Johnson Joy Ecuador Hanet Hijikunda Yili Adamona Atleho Del Yazi Equijin Washington Avo Nation Yanalish Ein del kati epidemiology department has age. So lai kon hiken hinen khalchinen dal nashota. Bilbeda has an ebony na hanet hichikunda yili. The mo na atle. Kui jie. Dinat was the baka. Kon undat de don hichikundali. Ebe hada inos nishik inosli. Eben na che kon hichoba inchkit. Anid in lay chinli na hoche. Fair is lean. Parade that is lean. Akonde shidotka. Hadesh Lego Hadiyado Shinab Vice President Lizer Akon Lego Hinash Ego Ya Yamas Chadas and Lord in the Yamas Chadas here Chicane was leaning Ebony na Adon he Washington that does casta Nana Ado di na kin the monat leon that she ya ni fair Ntsagi navonation fair a left or left. Ishi agat edo les parade appel. So she ada liado le she keno sin kudo and then hitch good qui liado le the neck etch. We come to you again this Tuesday town hall. One confirmed case of monkeypox here on the Navajo Nation in the Gallup Service Unit area. That hasn't changed. Thank you for staying the course, wearing your mask, social distance, being careful with one, around people. We just had a fair in Central Agency, and everybody was even outdoors wearing masks, which was great. Appreciate that. We just got to stay the course with COVID-19 in the around us. Low numbers now, but that doesn't mean we take off our mask and not do the things that we were doing before to keep it low. And in 2 weeks, we're going to have the Navajo Nation Fair in Window Rock. Stay the course, everyone. Continue to follow these protocols. Get your vaccination. Healthcare professionals, healthcare facilities are encouraging people to get vaccinated. Now our children are getting vaccinated. So we make sure that they're up to date on their boosters. All of us. Over 50 should have 4 shots. And there is also monkeypox vaccination if you're in that most vulnerable population category. So visit the website on Navajo Department of Health, and you'll be able to get more information. But today, we got Navajo Department of Health, the epidemiology team, the Indian Health Services, going to share with you some updates. So please stay tuned and share that with the rest of the people out there, because information is power. You got that information now, and please share it with your family, maybe during dinner time or other gatherings. So take care of yourself. God bless you. Wear your masks, use hand sanitizers, and just continue to learn more about these viruses. Now there are 2 here on Navajo. We need to take care of one another and take care of each other. God bless you, and God bless our great Navajo Nation. And now let me turn it over to Navajo Department of Health Executive Director, Dr. Jill Jim. Dr. Jim?
Thank you, President, for the messages regarding COVID-19 and monkeypox. And say Dr. Jill Jim Inchado, Don and the look on the song touching Basashindo, a shame the Shichado, Zatlane the Shinova Adona, the Sante Ayasinosha. And always just thankful for having these town hall meetings that we have every week for those that attend. I think you get information more about what the status is. Sometimes we don't make it out to KTN or other areas, and you might not have time to go and read all of the situation reports that are out there. But I know that with COVID-19, we are still seeing cases. COVID is still out there. It has not gone away. And not only with the COVID-19 pandemic now, as President mentioned, that we are still monitoring and conducting surveillance on monkeypox as well. And I know our health professionals last week did a good job explaining the monkeypox, how you can get monkeypox, how you can request for a vaccine with your local health care provider as well. So I just want a message to everyone just to continue to do what we need to in order to keep ourselves and our relatives and our families safe. So there are orders that were public health orders that were implemented a week or so ago, and they really looked at the social gathering limits and outdoor gatherings, and then the masking requirements, while we're still looking at indoor masking as a mandate, and outdoors are a little bit more flexible where you don't have to wear a mask if you're more than 6 feet from another person. So just recognizing that we're doing the best that we can, recommending the best solutions right now for that to work. I know that with the school situations, most of the students have been back in school for maybe a week, 2 or 3, or maybe some are on their 4th week, but we know that we really haven't seen a cluster report from the schools yet. I know that masking probably has a lot to do with that, and then also getting our kids up to date on their vaccines, very important as well. So vaccine efforts for not only for COVID, but those also at risk for monkeypox need to see their healthcare provider to get an up-to-date vaccine for COVID. So it's important that we do that. I know that nationally, I think we are probably struggling as a nation to try to get our up-to-date boosters, but in Indian country, especially the Navajo Nation, we're doing a good job with our elders, since um, those elders, or our elders, are most at risk for getting COVID. And we want to just make sure we keep everyone safe as well. So otherwise, that will be my general update. So if you had maybe that's Kingston, Salt Lake, or Albuquerque. Those are that are listening from far and beyond. Thank you for joining us today for our weekly update. I'm going to hand it over to Captain Johnson. He's with the Navajo Area Indian Health Service and also a member of our Health Command Operations Center as well. So take it away, Captain Johnson.
Hey, thank you, Dr. Jim. It's beautiful. I appreciate your updates and the work that you and President Nez and Vice President Leiser do, certainly on a daily basis. Just again, just reintroduce myself. Captain Brian Johnson, serve as the Deputy Area Director for the Navajo Area Indian Health Service here in St. Michael's, Arizona, and work with our federal system as well as our tribal healthcare system here on Navajo Nation in various facets, and just appreciate my time here on the Navajo Nation. Not a whole lot of updating today, but I do think it's always great if we can take a moment, and I know Dr. Jim just covered some information about COVID-19, and yes, it's true, we still continue to see cases. Every day we monitor our hospitals, our health centers. We share information across the board with other healthcare providers to understand where we stand presently with COVID-19. We're doing fine, but we always want to remind the public to certainly remain vigilant in doing the things we can do to try to continue to limit the spread or transmission of COVID-19. And maybe it's been a while since some of you have heard, about COVID-19, and you're trying to remember, okay, what types of symptoms, what types of things might I feel if perhaps I was exposed and perhaps I've caught the, COVID-19. More recently, with some of the more recent variants, what I've heard from many is I'm experiencing something like allergy type symptoms, where folks have maybe a slight fever, they have a cough, they have maybe feel a little bit fatigued, have a runny nose or a sore throat. Those are pretty common over the last year or so with COVID-19. We've been very fortunate because the severity hasn't been as severe as it was back in 2020 and early 2021, which is a very good thing. And a lot of this is based on the variant that we have at any one time. And so we know that some of the variants of COVID have resulted in more severe symptoms, while other variants have resulted in milder symptoms. And this is why it's really important for us to remain vigilant, is that if we should see a different variant, we just want to make sure that we're still understanding what actions we need to take, particularly if it causes more severe symptoms. So some of those symptoms, again, if we look at the big picture, can be fever, chills, cough, shortness of breath, tiredness or general fatigue, muscle and body aches, headaches, loss of taste or smell, sore throats, congestion, nausea or vomiting, and diarrhea. And so any of these symptoms in combination or singular can be a sign of COVID-19. Of course, at our healthcare facilities across Navajo Nation, we continue to encourage folks, if you feel like maybe you were exposed, maybe, or if you're feeling a certain way consistent with some of these symptoms that I just mentioned, our facilities are still doing the testing. That has not gone away, and we still want to provide those services for the population here on Navajo Nation. So certainly reach out to your health care facility. And then many of you may have some of the home test kits, and those two are great to do some checks here and there as well. So we do encourage those as well. Just one item that I would say about the home test kits is make sure that you're keeping those in a place that's not direct sunlight, or in the back of a vehicle, or even in the cab of a vehicle over a period of time, as that can be harmful to the test kits. So it's best to keep those in the home environment, in a place that's out of direct sunlight. Just in a dark, cool place is fine. Just wanted to mention that. We continue, I always like to emphasize on the town halls that we continue at our facilities, our health care facilities, whether it's a IHS facility or whether it's a tribal health facility. We are providing a service, test to treat, which means that if you come in and you get tested, if you are a patient who we believe requires treatment, we provide treatment at that time. So we want to make sure that we're taking care of those who might need a little assistance through therapeutics or other medications to help if they're COVID positive, and maybe they're more of a vulnerable group that's experienced more severe outcomes. We can provide that service for you. Now, many of you may remember back in the early stages of COVID-19, we did not have those therapeutics, etc., at our health facilities. They were not available at that point. They were not released yet or approved or authorized. And at this juncture, we do have that capacity. So if you feel that you need to be tested, certainly come in, and then we'll leave it to your local provider as to what he or she feels is the best course of action for your particular case. I could go on to many of the things we've talked about in the past, but I think it's really important just to say that in terms of COVID-19, that vaccinations continue to be the best way to limit the severity and hopefully prevent a person from catching COVID-19 from others. I want to underline that we're particularly most interested in really limiting the severity of COVID-19 in our patient and our population. That's where we've seen some devastating impact. It's the severity of disease over time, and so that's why the vaccines are so important. Could you still get COVID-19 if you are vaccinated? That is a possibility. However, it does fight the disease. It helps your body fight the disease. Plus, we know that it limits the severity of disease, and we've seen that through data over time. We watch the science and the data that we're provided and that we collect, and it does work. And we just want to make sure that people still understand just how important it is, whether you're 6 months old, 2 years old, or 95 years old, anywhere in between. It's important to continue getting those COVID-19 vaccinations, the primary series, and then along with the boosters series. And we know that it's kind of like the flu immunizations that we receive on an annual basis. Each year when we talk about influenza in the fall of the year, we know that CDC and others work together at the federal level to create updated vaccines. And they do that by studying what they believe will be the strain of flu or influenza that will be coming through our area that we may experience this year. And so they base those updated vaccines on that. We see the same thing with COVID-19. We know, for example, in our population that BA4 and BA5 variants are presently in our population through the surveillance that Dr. Jim and her team are doing. And that's a great advantage we have to understanding what variants are out there based on what we're seeing with our testing and our surveillance. And so the latest booster for COVID-19 does include protection for the BA4 and BA5 in that vaccine. So it's important for the public to understand that those adjustments are made to better protect you and I, your families, your loved ones. So please consider that. While we have done a great job across the board, and we've mentioned this on many occasions with our outstanding nursing teams, our provider teams across Navajo, with the outstanding response that we've had amongst the Navajo people here on Navajo Nation. It has been a very, very well, I guess, taken in terms of the vaccine. And it's been very effective here. And then we know the percentages, and we do track those. And while we've done very well, we can always do better. And for anyone who's out there who's still on the fence or questioning if they should get the vaccine, we still continue to highly recommend that based on everything that we've seen, all the scientific data we've seen, all the experiences we've seen with our patients. The benefit is so great for those vaccines. And so please certainly consider that if you have not at this point in time. Now, again, I just want to emphasize that those vaccines are available for children 6 months all the way up through adulthood. And so if you have questions about ages, hopefully that provides information that you need. But you'll definitely want to talk with your provider if you've had the primary vaccine series, and if you've had 1 or 2 booster shots, or maybe 3, or maybe you're now on number 4. You'll want to make sure that you're talking with your healthcare provider because each case is unique, and they need to make sure that they're giving you the information that you need. But again, as was mentioned here earlier, hand washing continues to be something as we're going through the fairs. And it's great that we're having that. It's that time of year when we feel the coolness in the air in the mornings and the days warm up. And we know that the fairs are happening out there across Navajo. It's really important at those types of events to wash your hands. It's also so important, even though we're outdoors, wearing those masks. President Nez mentioned that, and how folks have been wearing their masks at those events, and that's great to hear. And please continue to plan to do that. And then we also know that social distancing still does work, still is effective. So anytime that you have that opportunity, it's best to utilize that as well. Also, based on Dr. Jim's report talking about schools, we know that schools are in session, and we know it's that time of year when we all start going indoors more. And when we go indoors more, then we're in more direct contact with one another, or at least closely in contact with one another, breathing the same air indoors. And so particularly indoor environments, the masks are incredibly important. And I think we're demonstrating that if we take these precautions between the vaccine, the masks, the hand washing, the social distancing, kind of watching one space between another individual, we're not really seeing a whole lot of, or at this juncture, we're not aware of any outbreaks that have happened in the schools at this point, which is a great thing. We need to continue to follow these processes and procedures to make sure that we continue that throughout the entire school season. Want to take a depart from COVID-19 and again touch on monkeypox because it may be some folks' first time to hear about monkeypox. And this is a disease. It has certainly an unusual name, as we all know, monkeypox, but it's a disease that has been known at the international level. However, in the United States is something that we really haven't seen for many years, or quite honestly, historically, have not seen much monkeypox in the United States. However, we know that with this current outbreak that's gone through an international phase, and which includes the United States, as of yesterday, when we look nationally in the United States, I'm not talking here on the Navajo Nation, but nationally in the United States, we're up to 18,000 cases, 18,101 cases as of yesterday. Now, that number of infections with monkeypox, and we shouldn't really be comparing anything to COVID-19, but if you compare that to COVID-19, the numbers of COVID-19 are just way incredibly higher. And so 18,000 cases nationally in the United States, and there's lots of work for prevention and responding to any reported cases, which is critical. Similar to COVID-19, anytime that we have a monkeypox case that's identified, then we need to have a way of having that reported. We need to have a way of following up quickly with the individuals who might be experiencing that infection so that he or she can take actions to protect their family, their friends, their loved ones as well. And that system is in place through the works of Dr. Jim and her staff, Indian Health Service staff, tribal health facility staff, lots of people working on this here on Navajo Nation locally. Now, I just want to emphasize again, if this is your first time of hearing about it, monkeypox does not spread easily between people without close contact. So it's much different than COVID-19. They're two totally separate things. And we just need to understand that it does take close contact to transmit monkeypox. And that when we talk about the United States, when we talk about the Navajo Nation, right now the risk to the general population remains low. However, it is important for us to remain on top of this issue of monkeypox so that we're reporting that the public health system is responding to it, and so that we can make sure that we contain it as quickly as possible if and when we see a case. A lot of people may have questions if monkeypox is fatal or how severe is it, and it's actually rarely fatal. And basically, once a person's been exposed, it can take anywhere from 5 to 21 days, which that's a pretty large number of days. So if you believe you've been exposed, it can be 5 to 21 days before any kind of symptoms show up, which include a rash like pimples or blisters, and these can show up anywhere on the human body, including the face. It could be in the mouth. It could be on the hands, feet. It could be on the chest, in the genitalia area, other areas on the body. And the rash can go through different stages before healing completely. Typically, when someone does contract monkeypox, it's typically lasts about 2 to 4 weeks in length. And some people may only experience a rash while others may experience a number of other things such as fever, headache, muscle aches, even a backache or swollen lymph nodes, chills or exhaustion. So any of these things can be an indicator of monkeypox. So it's important to know, and of course the scientists and the healthcare providers are following to make sure. But people with monkeypox in the current outbreak generally report having close, sustained physical contact with other people who were infected with monkeypox. So that seems to be the consistent message is, again, it takes close, sustained physical contact for other people, from people who have monkeypox, for another person to contract that. So it's important that individuals realize that you're not going to contract monkeypox by walking by somebody. It takes close, direct physical contact in order to contract that from an infected individual. We're very fortunate because there is a vaccine for monkeypox. And generally, this is being utilized for individuals who are at most risk, who have the greatest risk factors based on lifestyle, and that will continue to be utilized by the providers. Our physicians are the ones who reach out and make notification to those who would need it, or those who end up making contact with our healthcare facilities who feel like they've been exposed. And again, the providers will work with them in making sure if they feel they need the vaccine, then they'll provide it, as well as other medications that are available. So we're very fortunate early on in monkeypox that we do have a vaccine, which was quite different an experience during the COVID-19 situation. So we're very fortunate to have that. We do, through efforts of the Navajo Nation and through the local healthcare facilities, requesting the vaccine, requesting the medications to the national level. We were able to get some allotments or some supplies of that vaccine. It is here locally, it is at the healthcare facilities. And again, the providers, as information comes in concerning cases, the providers will be the ones who identify, and working with the healthcare team and the patients who will receive those types of vaccines. So I just wanted to mention that. So with that being said, I think we've said during the last call, certainly for those of you who's looking forward to your upcoming fairs, don't let monkeypox stop you. Go out and enjoy yourself. And just know that it takes a sustained physical contact over a period of time and with an infected individual to become infected with that particular virus. And also just remember your protection or your protective cautions with COVID-19, and masking up being of particular importance, and getting that vaccine. But otherwise, I'm going to stop there, and I just want to say thank you again for the opportunity, and I hope everyone's enjoying this. What we're seeing is fall type weather to some extent, and excited about the upcoming months coming in. And thank you for the opportunity. And I'm going to turn it over now, I believe, to Del Yazzie for his report from the Navajo Nation EPI program. Del, you have the floor when ready, sir.
All right. Thanks, Captain Johnson. Hello, everyone. I'm going to provide a quick update here on the Navajo Nation COVID-19 Nashni Nalka time period, August 19th through the 25th. But I'd like to acknowledge our epidemiology team for COVID first. So here are all our partners, our people from the Navajo Epicenter, Navajo Department of Health, IHS, Navajo Area IHS, the tribal health organizations, the 638 facilities on Navajo Nation. We also have people working with us from CDC and the CDC Foundation, and also from Johns Hopkins Center for American Indian Health, and also from COPE, Community Outreach and Patient Empowerment. And then our people from Translational Genomics from TGen, Flagstaff Campus. And then, of course, our state partners from Arizona, New Mexico, and Utah Departments of Health. These are all folks from these entities who are really part of our epidemiology team throughout the pandemic. So just wanted to recognize them and acknowledge our big epi team. So our recent cases and trends. Here's our going back. This is a 60-day time window. With the orange line is a 9-day moving average. Of course, our daily cases are in the blue bars. They do vary quite a bit every day, but the orange line kind of like smooths it out, so you can see a better trend. And over here on the right, you can see a little bit of a downward trend the past couple weeks, which is a good sign for us, and hopefully that will continue to go down. So a little bit of less cases, even though, I mean, still a high number of cases. It ended at about 100 cases pretty much a day over a 9-day period. So that's still a lot of cases for us, but we are trending a little bit downward. So we'll see, continue to monitor that this week. The core metrics here, the Navajo Nation new cases per 100,000 people over a 7-day period is now at 495 cases per 100,000 people. And then percent staff beds occupied by COVID patients is at 3.5%, which is at medium risk. And then Navajo Nation new COVID hospital admission rate per 100,000 people is at 1.3 admissions per 100,000 people, and that's at medium risk as well. Supplemental metrics here, there were 784 new cases over a 7-day period, which is a minus 6.4% change from last week's report. So it did go down a little bit by 6%. And then 7-day lab-based test positivity is now at 13%, which does exclude the home tests, but it went down from 18% last week to now 13%. So this also continues to decrease. Hospital capacity for bed occupancy remains stable. We're still below the 80% threshold for both hospital beds and ICU beds on the Navajo Nation. And then vaccine coverage. Vaccinations are still ongoing across the nation. We are now at a 69% have completed the primary series, and 44% are now up to date. And then we're still doing the COVID strain surveillance with our partners from TGen and Flagstaff. So all the Omicron sublineages listed here have all been detected on the nation so far. And, we're seeing a lot more of the BA5 sublineage, which I'll go over here in a little bit. And then the vaccine numbers here, 129,144 Navajo Nation residents have completed the primary series, and 83,222 are now up to date. Just the epi curves for the entire pandemic. The blue line is the US, and the orange line is Navajo Nation. As you can see here on the right side. Across the US, there's a little bit of a downward trend as well, seeing less cases, as well as here on the Navajo Nation. 7-day case rates here, comparison between Navajo Nation and the 50 states. We are number one. We have a high 7-day COVID case rate over a 7-day period. So the next bordering state with a higher 7-day case rate is New Mexico. And then Arizona, Utah, and Colorado, all with lesser 7-day case rates compared to other states. So as I mentioned, yeah, we're number one because we're still seeing a high number of COVID cases on the nation. And here's, you can see pictorially within our border or region, Southwest region, 7-day case rates. As I mentioned, New Mexico with the higher 7-day case rate with this blue color. So New Mexico is still seeing a little bit of an increase in cases within our region. And then community transmission here, a lot of red still for high COVID transmission. including our region here, with all the counties within Navajo Nation are still all red. Here's an updated, this is report 66, August 24th, which is last Wednesday. COVID strain surveillance update here. A couple highlights here is really the BA5 sublineage of Omicron. Still seeing more of that currently. It went from 388 cases from the previous report to 433. So really, actually, that's the only highlight of this latest reporting. Yeah, I mean, we're still seeing other sublineages, but not as much as the BA5. And this is the couple charts here in one. This upper one is just all these facilities do send samples to TGen for sequencing work. It's just showing that most of the facilities are still participating in this effort. And then the bottom one's more of the sublineages of Omicron. As I mentioned, the BA5 here on the top row, we're seeing more of the BA5 currently on the Navajo Nation. And this is CDC variant profile for the nation. The BA5 variant of Omicron continues to be the predominant variant across the country. And last, this is our high-risk chapter list for COVID. 51 chapters made the list this week over a 2-week period. It did go down from 58, I believe, last week, 58 to 51, and this continues to decrease as well. So that's also a good sign. And if you go across to the right, going back 6 weeks, these 43 chapters have been on this list each week for at least 6 weeks. So these are our chapters. So I'm going to stop here, and I'm going to hand it over to Shema. Dr. Fowler, it's all yours. Thank you.
Yeah, Kodo na alkanas nehi ba na win lei ba ye nitsen na do ye nanish in any kodo yat esh edos ne shady kodos echi ma idesh giznin slot for the chini bashin alot banda shigot as chedashanale todas aholiena are is chike adon he had he didn't need ole ada nada so gizi do da is not tsai halan aro kodon hinat anin lini don he is any Italate not anin lini Dr. Jilgin aja is inkides edo he hebedi nidole aron he is any Captain Brian Johnson aro shi yaj kodo del yazi na alkanas nihi na alkai ade ya nahadne aro di de kosnas states adafedi nidi banda huilne doshi hut abe waji dan de jo abikit it hani dobikit it heat abijilya ara apelage na snehi do saon ordinately jo e kodo bahuilne aro is it ben up ben bahasli ido booster the deshne jo atrani gaho e honasi is it ide is it dad now jo hot hil jish ado nasgone ne jibe ta holian hisne kodo hinat anin lini ado di od ta hon ni od en das ni he kodesan hisli hananas ni monkeypox hisne she kodo asa apetol na kodo ni yana ta hodne ado di andad na ni do na hoche da banda al dehi jo oye go be ta holiani aj allaho ni hisne ado don dan hidine According to Chidon, his abetata des balon dakhe, hala atin chikishi benina, Sashi ani o yushi datasato sland, hasto it arole, Diego da hayado, a dacha of zi, John hidine, Hashine la di ini hananot, ani oyo yada, tla akonde, Nahas twin his zani, Nihama, Aaron hijeda dan lini yego yen dan kind ati distingi. Aro aj is lini samba hadalia. Aro di quad etalade aj is il impetna anishije jo ad quado nen long deputy area director jo etalade aj is el age aj binanish il quado Captain Brian Johnson dabadine. Diad enepati ishtiji zel ebelta tahaja aja sato telade not ani lido yego yilnad nish aja bati ishtiji zel idan lige akodi nasnihe ati nasni John Hitne do ati jikish ajashi a kodol na eko do a ni zecha alianda a kodol na ot John Hitne akodi zel ebelnahas ago ati nal khato ze benabben baholoni jo aji ya johna ado di ahonwade na al kahi la taholno alto ado shanjit an sofnele hajo oyo ahowan ahos kazke jo kwa anaz nelon jone jo di na al kahom teske ilnini ot aba ahosyan hilne akonde di ze nlini na kha alya yego delne do bedelne don zago ze ionet stada dole hala ze nlini na ba arona kunne ya na hol ne di ze benappen hasli igi edi as tran de zet ni yajin hi away tran de ze benach do dako les twido sani ze ba hol no jon hitne di the kwasnas it's tapedi nini di the kwas ni do wel yeni anashni hi just algenor nen hilne a kodina a hoche banda il de do bahata ol dei hashino sa kon hi chidon hi zep da des balon dakhe ikhen hilne a was in a kwande di monkeypox bedi nini alkha khatis tho at ilo jo di sodi kha ajata soda kha leti hatis kha zapa kunne eta ya at isni dost I hot kwande ze baholno sto akodina kidole di the moj ashi ana doi it hashine lanchi la bit in the hast ishi anzako ya bedol nako kwande ze ya do yego we the not isla Arodi ag age be not the John Hilne yego da ya hon da honik as da honik as Arodi shiyaj nini delyazi kodo dinar nasni nar kahi di benit ads ose an nas eight at that only not dino ashla your kaseda nas kai ya nahol ne konde di betende nishido hebedi ni hilne yo tojido hos tojido so le had nahas di bisin ishtiji izel be ezel ibel nahas ago John Hopkins at the Lieto CDC jo hilne nish ot da il ka okoti as tantin jingun ani yagonal kil jot konde di neza dino anas dino ashtla akone la di tos jije akone la benada dolna akonde di Israel tesk epel nahas angodo asan da no on zahaj shido zagoda Arodin al-Kahige atinda al-Ka Ado Israel ion tesk enaz nilide anahas konde di ahadal ine ati ahadal akodin hid nebel gehout zoge bel ilkhana nelodi ishlatin gehout zone ni geet da allange yi khati has khanche ye go da hot zaki da hwan ni li ajin hi allange akoya ando ni edi nido nitsen hot arts hodilzen akodi nas de kosnas et atapedi ni sa and only latino khastra na sleepna ni de ko at ende hinetsaga na Epidemiological anast edna zatino anast et akone na in hits at de gonana kilter a variant nini Arodi Tatnas Nille Betlanta Atlek Nahas Ango Aja Edi Ishlatino Asa Anasni Benabedatil Nai and Sena Bahon Eda Ishlatino Atsepi Ako Ajato Yanal Kil E Kodo Ba Hena Nitzin Ako Anhi Eshik Edo Shidne Anhi Ben Achinotin Hajo Ben Achinotin Do Be Eta Akolia Ashi ani hone niko kane sa to kante to te honda ko yega ba hosia di ad tostoit ini ne sedi da anda ja benda sa ni chin ze abada des ba ha ishin da ni hoda chiyan da to deli da apen da alcho asa khaza azis nas ne lo ya atesh kedo shne Ot ashi yego be eta aholia. Adon das nishi ni hito. Ajashi anas nishin den hichiton hize abadada des balon das nish. Dik at ehun ne eto sats. Besekera ena di chichito dos zet abadada des balda. Ado di otra na hago to ba ahonasen. Ad jaga hocheda del kosota. Asa di hokehodot asa ena be ba aholia jon hiti nido ba nan hinika. Ado di kinahas ango ha ishi tabiel yedo afiskota jo e ad ende a andalia aho a anda tledo ha jo de nepe ba a anatle hala aita ben a hini tin kadiana si trakane trakna khape na ni tina ha jo a anda tledo de nakhane shi gato chetan tahalne ha jo pesh bahane da bi yata Jo je customer lini ha jo op ka naswo ano ni hina ni shin a den hi chahan na a jo sa baby che ata ke ni hiten na et twisani dan la a den ta hal nan ta ka hada a shon de ba ta hal yan da ba ta han sen ano an hito be ta a khosya na ani no lini ni hito ha jo na khanda ni shi ha jo be che ke Wat a ne I gati I ba ka o wat kwa hot nan nisto tapetohne bitni dan hitosen ado nas nishi nat ani nido tatinosen hajo hot hiet na anisha ado ot eheta osa hajlo os the net is kanto the nebe bi gata ahit no nasi in a hostile environment not that ahit ne ado otatohne o hajo na nish at eheta hajo na nish joka na stol nish adon stol nish hon stol da do hajo na nisho o hajo na sos o leto ade na nishine klinido ye lahnel ani pa a se to jo hota kodo na antin lini ni hit hona ne liado le tido tsit ego ni hit ni enna to yinni hinne hashine la anidon hitrata hatsido sato yat il chebeta il ido be che adelti jo ahane ni hizaba akhlia hajon hizatnosen to kheshi bi gahape ni da kodo yis belchihin inni nechonne namah neja Belchainche na achinin so kenna tloshi ajo ahtenne da nila kosani hot ayen dan tkina hot ish koshik edo shidne ye go ata holiado hot ashin kolon hiche hanne lini ina neliado le to ye ata holia kon toshin do le shik edo shidne na ye ha